If we want to make sure that people are vaccinated and we don't want people to be misinformed, we need to meet people where they're at.
A neighborhood in Surrey revealed to be a hotspot for COVID-19 infections also has the lowest vaccination rates, according to a leaked report from the BC Centre for Disease Control. In the South Asian community, some health advocacy volunteers now want to see more clinics in gurdwaras and other faith-based community centres, which they suggest could improve vaccination rates.
As we know, the positivity rates in these communities are much higher than other communities. And so I think it's very important for the government and for health authorities to make sure that these areas are targeted in a way that is culturally effective as well, so that it's not blaming people, but rather it's helping solve the problem that's at hand.
Sukhmeet Singh Sachal with the Sikh Health Foundation volunteered at the first vaccine clinic in a Surrey Gurdwara on Friday.
That's something that my team and I have been advocating for many months now, where we actually started our project last year of June 2020, where we worked inside gurdwaras and we were teaching the public about COVID-19. And that's where I realized that there was a huge problem and a huge disconnection between the mainstream communities and the South Asian communities.
Myths and confusion about vaccines were among the things Sachal's foundation worked to dispel, including infographics like these using their community's own languages. They also showed their community what they needed to be ready for their vaccinations.
A lot of the daily briefings that were being done by the Dr. Bonnie Henry, which for us, for instance, might be easy to understand because we have the health literacy background, or we know how to speak English fully. But for a lot of communities, especially in the South Asian community, for elders, they might not know English as their first language. And so that's a huge barrier.
Friday's vaccination clinic saw around 400 registrants, and volunteers were able to serve them in their own languages. UBC's Dr. Farah Shroff says images from India may have also affected attitudes on vaccines throughout the South Asian diaspora.
So if there were Canadians of South Asian heritage previously who weren't really, who were maybe on the fence about whether they should get the vaccine or not, they may have been pushed over to the side of getting the vaccine now, given what they're seeing back in India.
Meantime, in Surrey, another vaccine clinic will be open on Sunday at the Guru Nanak Sikh Gurdwara. In Vancouver, Kier Junos, City News.